diseases. Let me see what are the importance of the pericardium 4. That's called as there is a gate called as there is this also one kind of the golden gate or the C gate is existing on the elbow forearm region. Now let me see, I'll just take off this needle. And then now the next point to be known as a semen. So let me see before stepping into the semen. So these muscles called as a flexor muscles. These muscles to be known as a extensor muscles. These muscles are extensor muscles. These muscles to be known as a flexor muscles. So how many muscles are there in the hand? Nearly 20 muscles are there in our from the shoulder to the till of the termination of the fingers. So therefore let me see on the flexor muscles. So these muscles are flexor carpi radialis muscles, flexor carpi ulnaris muscles, and then the interosseous muscles are the superficialis muscles. What is the superficialis? That means flexor pollicis extensor, flexor pollicis superficialis muscles are there, all these muscles, but you can find there is a one kind of the tendon comes from here, that there are the two tendons majorly you can find the tendons to be known as a flexor carpi radialis tendon and a palmaris tendon and a flexor carpi ulnaris tendon. Remember the word tendons comes that all tendons muscles will become the tendons. Now if I say flexor carpi ulnaris tendon, that means is the flexor carpi ulnaris muscles will become the flexor carpi ulnaris tendon. Yes, likewise now I am talking about the flexor carpi radialis tendon, that means flexor carpi radialis muscles will become that tendon. Then the palmaris longus tendon, then the palmaris longus muscles will become the palmaris longus tendon. Now let me see where those muscles are existing. Now two tendons you can find. The flexor carpi radialis tendon, this to be known as these two fingers to be known as a flexor carpi radialis muscles, right? Thenar muscles, lumbrical muscles, and also digitorum muscles. That is a different. You try to find out these muscles to be known as a flexor carpi radialis muscles. Flexor carpi radialis muscles are there, so that muscles will become one tendon, the tendon to be known as a radialis tendon. Now the another tendon to be known as the palmaris longus tendon. This tendon will become connecting to the palm. From the palm it reaching to the main center of the palm, then it terminating to the digital muscles. Now let me see this tendon to be known as this finger side tendon to be known as a palmaris longus tendon. This is the thumb side tendon to be known as a flexor carpi radialis tendon. Now all of you try to do like this. Close your fist tightly, and then find out this tendon. Right. So all of you just do it. You do it like this, you can find the two tendons. You close it tightly, you can find the two tendons. That tendon you try to find out. This tendon is the flexor carpi radialis. This tendon to be known as No. Yes, this is, but I am talking about the palmaris longus. Yes, this is correct. You told is the flexor carpi ulnaris tendon. But I am telling you is the pinky side. You just do it like this, and then you can find the two tendon. Ulnar side is palmaris longus. Radial side is radialis tendon. You keep it in the mind. Some time. So all the 4 points, the semen, and then Chianchi, Nikwan, Darling, 4 points are located. Since you know this idea, then it's super simple to place it where this point is located. Right. Let me see now. I just apply the needle. So where exactly the phi chun? 3, yeah, phi chun proximal to the Ventral wrist crease. This crease to be known as a transverse wrist crease or the ventral wrist crease. From this wrist crease, how many chone? 5 chone proximal to the ventral wrist crease, midway between the flexor carpi radialis tendon and then palmaris longus tendons. In the depression, the C-men point is located. Now let me see where is that point is located. Now how many chone? No, from here to here how many chone? Very good. Proportional measurement from here to here is how many chone? 12 chone. Then we try to find out where the snuff box. Snuff box from here, snuff box, and then from the lateral end of the cubital crease, that is LI11. From the LI11 to LI5, you just select from here to here. You show to them. From here to here, you just select, this is the half. This is the half. Yes, this is 6 chone. Very good. This is the 6 chone. Now come little forward. This is the 6 chone. Then again I wanted to use 5 chone, right? Now from here to here, you just come down. This is as a 3 chone. Then again from here you come down. But here in this way you select that point. That means is the 5 chone proximal or the 7 chone distal to the elbow crease. Now I just selected now the point. I just apply the needle on the specific region. That point to be known as a C-men. Used the 1 chone needle to the deeper level. Tumba novaita. So, very good. Deep breath takondro no hagilla. Sari, however, the pericardium 4 points are really great point to treat for the many indications. Acute anginal pain. Acute anginal pain. The patient is suffering like a cardiac pain or the epigastric pain or the pectoralis major pain, pectoralis minor pain, or the internal costal pain, or the external costal muscles pain, or the ribs pain, or the intercostal nerve pain, or some kind of the arteries is the coronary artery pain, or the angina is related to the myocardium pain. But certainly you can use this point 1 chone deeper level for emergency purpose. Then you can treat the patient. Further, the patient is complaining, I do have the chest pain. Until the patient goes to the hospital, we can manage by activating some of the points. Now the pericardium 5 is the general pain they do have in the cardiac related. Certainly they having the great impact to treat for the palpitation, insomnia and other related disorders. You can use it. But now I wanted to add up this one specific point as a tung acupuncture wanted to add up here, because few of them are very interested on the tung. Then you can use this point is half chone lateral to, slightly lateral to these points. But this entire area is treatable for the, especially for the pelvic related disorders or the anal related disorders, hemorrhoids, especially the bleeding piles is there, or the internal piles or the external piles can be treatable by activating this specific point. So therefore this good point to treat for the numerous diseases. But however the pericardium 5 or the pericardium 4 is the C cleft point of the pericardium meridian. That means for the all the blood related disorders and also acute conditions of the heart and then brain related condition where the insufficient blood flow to that particular organ, that time strongly it pushes the blood to the brain. In that way this point to be activated. Certainly that goes to the cardiac system. From the cardiac system it goes to the Tianyu. From the Tianyu it goes to the vertebral region. From the vertebral region it goes to the circle of the Willis. From the circle of the Willis it goes to the right communicating artery and then left communicating artery and then middle communicating artery. The energy level goes to the brain system. It encircles to regulate the overall the central nervous system and also related to the cardiac system as well. So now we understand about the semen is the most important as a acute conditions. Now coming to the next beautiful point, beautiful amazing point to be known as a Qian Shi. Qian Shi. Where this point is located? 2 Chon distal to the pericardium 4. This point is located midway between the flexor carpi radialis and palmaris longus tendon. In the depression, this point is located. Let me see, we just apply the another point. That's called as a pericardium 5, 2 Chon distal. 2 Chon distal, we just apply the pericardium 5. So try to find out feather touch. That means is the touch to 2 tendon. Place simply. Where is the 2 tendons? प्यार से छियो से, मोहब्बत से छियो. Feather touch. Try to find out the 2 tendons. In between इतना beautiful एक depression मिलता है. बच्चों को आपने खिलाते हो ना, तब उनका जो lips का movement, lips जब touch होता है, so we feel that amazing how so epithelial tissues are existing. Baby's touch is feather touch, yes or no? Likewise, you can feel some kind of the touch inside the 2 tendons. You feel the epithelial tissues like sensation. That sensation, you just apply the needle, that area to be known as a pericardium 5. Now the Qian Shi is the amazing point. One of the, I think, I uploaded the one video related to the 5 master points in the body. 5 master points, among them one point to be known as the Qian Shi. That means the how there is the 3 Chon proximal to the wrist crease. The point is located here between the 2 tendons, which is the junction of the 3 in meridians or communicating point. One to be known as a heart system, the second to be known as a pericardium, the third to be known as a lung system. The lungs, heart and then pericardium. There are the 3 in visceras or connecting point to be known as a Qian Shi. Here I wanted to add up to recognize it to in your mind, that to be known as a Sun in Chio. That means is the spleen, liver, kidney, pancreas. 4 organs are communicating point to be known as a spleen 6. Here I would like to repeat what are the 5 master points.
Sir, please repeat it, sir, the sentence.
Spleen, liver, kidney, pancreas, connecting point to be known as a spleen 6, and then the pericardium 5 to be known as a lungs, pericardium, heart. 3 organs are connecting point to be known as a pericardium 5. Then the another location to be known as a sun, yang, low. That means is the Sangio 8 is the large intestine, small intestine, triple warmer connecting point to be known as a Sangio 8, and then the stomach, gallbladder and then urinary bladder. 3 organs are connecting point to be known as a GB39, that is Swan Chung. Right. So these are the majorly 4 points are controlling and regulating to the entire system of the body. So known and unknown cases of the diseases, you select only the 4 points. Then the 4 points, it covers the broad spectrum of the organ. 12 meridians are meeting point. There are the 4 points. In that you can regulate only the 4 points to treat for the numerous diseases. Certainly that having the great impact. You wanted to use as a moxibustion or you wanted to use as a electrical stimulation. Certainly this pericardium meridian is partially you can do the electrical stimulation, but all the points you cannot do it. But these points you can use the electrical stimulation. But of course, is the one point is the very, very vulnerable point to the electrical stimulation, that I'll tell you which is the point. So hopefully the pericardium 5, the people who are suffering for the CTE, T. S is the carpal tunnel syndrome related condition where the median nerve is affected. The medial nerve got the compression on the arteries of the wrist region. That time we can use this CTS conditions. Further, the children or the adults, they do have the called as a nightmares. So that means is the ROM, range of the motion of the eyes get differs. But the children, especially school children, they'll wake up in the midnight and they start, eyes are open, but they are talking. They are talking like a real, but they cannot recognize what is the dream world and the natural world. But they understand the dream world also natural world, vice versa. Sometimes they'll get the frightening or the horror or the terror type of the dreams they will get in the night time. That nightmares are controlled by the 2 points. 1 point to be known as a Chianchi, that is the pericardium 5. The second point to be known as a Li Dui, that is the stomach 45. Both the points you can treat for the unwanted dreams are coming excessively at the night time. Of course, yearly once you are coming the dreams, but may not cause any problem. Today you go to that UB city or somewhere, you can have a fun horror, some kind of the horror film, then you are coming back to home, then you feel that horror dreams you will get in the night time. That causes much more problems to the children. So therefore is not that kind of the situation we shouldn't create to the children as well. By taking the TV and then laptops or the gadgets in the phone they used to see, that same thing it will come in the night time. That also can be subsided by activating this the pericardium 5 point. At the same time is the patient is complaining, I have the pain on the shoulder pain, especially on the anterior shoulder pain I have, which is connected to the pericardium, lungs and then heart. This pain is related to the 3 organs. This pain is different, this pain is different, this pain is different. So therefore patient is telling I have the pain on my shoulder region. That indicating you can use the points related to the, as I told you, 3 in meridians or the communicating point. Therefore the shoulder related problem or the chest related disorders or the breast related disorders, certainly you can add up this the point to be known as a Qian Shi. Now coming to the I love again, many times this called as a Ni Kuan, that is called as a pericardium 6 point. Is every day if I see nearly 50, 60, 70 patients, among them normally I can say greater than 30%, that means is the 50% of the patients, I normally apply the point to be known as a Ni Kuan, that is the pericardium 6. That name itself is the Ni means inside, Ni means inside, Wei means outside. So therefore Ni Kuan means is the gate, or the Kuan means is the junction. So this is the Ni Kuan gate where the inner gate is used to treat. I think the P6, the point is, I would like to show you here the pericardium 6 how is connected. Yes.
Janakiram sir, please mute.
Now you can have a look how the pericardium 6 point is. Once you activate the pericardium 6 point, let me insert her, then we will talk. Without inserting it doesn't work, right? So let me apply one needle to her. Good. Thank you. And just apply the one more needle on the pericardium 6. You just take the deep breath. You just take the deep breath. Just take the deep breath. Yes. I inserted the needle here. Pericardium 6 I inserted here. Then the needle has came to here. You can find the needle in the Sanjo 5. The Sanjo 5 needle is nearly this much needle is outside. Right? So 1 centimeter needle came out on the Sanjo 5 and the pericardium 6 I treated. That means inner gate and then outer gate together I treated. One single point is treatable for the two conditions. One is the wake one and then neck one. Both the points we activated by using the single point. But however, the deeper level, this point is located, that to be known as the median nerve. So inside, please be seated. But now there is a artery. That artery to be known as a medial artery also existing, medial nerve also existing, medial vein also existing on that region.
We will also practice that physics.
I should apply you. Wow, it's amazing. Certainly. So we'll do it then. So pericardium 6 is again, I love this because this is one particular problem, one particular point. I think many people told related to this point before stepping into my lecture. But however, you know the secret of this as a triangular Buddha or the Buddha's favorite points to be known as this is the P6 LU9H7. But however, one single point also can be treatable for the numerous diseases. My professor used to say, whenever there is even the many authors has written one single point treatable for all the upper extremities related disorders, all the upper extremities related disorders treatable by using the single point, that point to be known as a P6 point. Then all the lower extremities can be treatable by using the single point, that point to be known as a lower extremities are treatable by single point. Already I have completed. SP6. Then
UB40,
UB40, UB61, UB40 also. Then tell anything whichever you feel. Lower extremities are regulated by the single point. The point to be known as a Jiaxin. That means kidney 8 point. One is the upper Tantian, middle Tantian, lower Tantian. But the lower Tantian are regulated by the 2 points, but majorly that is the spleen 6 and also K8. But the K8 is the most imperative point, spleen, liver, kidney connecting point. Therefore, the K8 point is the Chiaxin, and then the pericardium 6 is the upper extremities. Both the extremities are regulated by the 2 points, but however used to say nearly 411 acupuncture points are there. Among them is the most important is the 300 points. In that you can bring down nearly 200 points. In that you can bring down, it is the 100 most important points. In that 100 points, it is the 60 most important points. In that 60 points, it is only the 30 acupuncture points are important. In that is the 15 acupuncture points is the most important. Among the 15 points is the 12 is the important. Among the 12 is the 8 is the important. Among the 8 is the 1 is important. That point to be known as a, I love this, that to be known as a Nikwan. That is pericardium 6 point. So this is in fact is when your software is good, soft copy is good, psychology is good, your blissful thought is there, you have the good emotion is there, and the good intellectuality is there, then you have no jealousy with anyone, your heart is good, your heart is white, your heart is not black color, but however I am the black, but my heart is white, but brain is good. But that condition certainly the patient will be blissful when the Nikwan you just activate, the blackness it goes, dirtiness it goes, the hazards it goes, which is the morbid accumulation, it goes from the cardiac system. Of course, this is the channel, it clears the entire pathway of the cleansing. You know that is the called as the angiogram to be done by the 2 ways. One is the CT angiogram. the second angiogram to be known as a putting, there is a canal or some kind of the thread catheter conditions, but however that get the purification of that, but this is the pericardium 6 to be known as a natural catheter to be get done to the cardiac system to cleanse the cardiac system. I think all the cardiologists, if they learn this art to be known as the acupuncture, but of course for the most of the cardiac related, but I have the desire, the Ministry of the Health and Family Welfare, Government of India, do this kind of the council, that through that this can be implemented each and every hospital, the general hospital or the specialization hospital, gynec hospital, cardiac hospital, neuro hospitals, locomotor hospitals, but this will be one primary health care should be there in that respective place. Then certainly what the cardiologist or the cardiac surgeon does the cardiac conditions, he do the stent or bypass surgery or grafting, anything, this kind of the conditions can be reframed to the maximum level, can be reframed to the maximum, greater than 50% of the cases. Certainly we can use, even we would like to talk to the Professor Dr. Devi Shetty, then let me check with them. If those people are really like-minded people are there, then definitely, of course, he is very believes in the alternative medicine, he believes in the complementary medicine, he believes in acupuncture. Personally, sir's family has taken the acupuncture treatment. In that case, we can prove, we all should prove to him that definitely this can be implemented in the Narayana Health City, and most of the conditions we can save, because you know that today the greater than 2 lakhs or 3 lakhs, whatever the fees is now taken by the people, when all the people doesn't have the money, in that way we can do the service orientation to that particular hospital where the people doesn't have the financial assistance, so that time this itself they can refrain to going for that modern medicine and also the complementary medicine integratedly work together, that maximum benefited for the all the cardiac related conditions can be done for the maximum level. Hopefully this task and this message reach to the Health Ministry of the Health and Family Welfare Government of India, the JP Nadda ji, and who is the person handling for the health and family welfare. I respect him, but once he will implement that, but certainly that can be implemented to the across the country. And even in China, most of the conditions they do the anesthesia by cardiac surgeon. Doing the cardiac surgeon is the cardiology, he is doing the surgery for the heart related problem. That time in China they are doing the cardiac anesthesia as well. Without giving any kind of the anesthesia, they will going to do the acupuncture anesthesia to the cardiac related problem. In that way, the people who are the specialization in the cardiac acupuncture anesthesia or the anesthesia in acupuncture as a specialization, Nima and then Veima. Nima, Veima, where the 2 points are there, especially on the below the knee region, that called as a major anesthetic points in our body system. So therefore, likewise, many acupuncture points are existing. In that way, we just strongly activate that point. Even the cardiac surgeon to do the cardiac surgery, that also applicable. At the same time, once we do this kind of the manipulation of the pericardium 6 to treat and refrain for the any blockages are there, stenosis is there, greater than, according to my clinical experience, 50 to 60, 70% of the blockages can be refrained doing the surgeries. However, the anti-clopidogrel medication or some kind of the thrombosis medication to be given to them and blood thinners, this will be really helpful, so that the hyperlipidemia related conditions, if that medicine for timely can be given, or we can use the spleen 4 point to dissolve the cholesterol, bad cholesterol, then we can do that kind of the treatment to the particularly major hospitals for the 3 months. Certainly they need not to go for the surgeries. normally. So this in this way that have the clinical experience by using the pericardium 6 point. Now the pericardium 6 is treatable for the 3 points you can add up. So 1 point to be known as a NIC1, the second point to be known as a Shenzhang Ren 17, the third point to be known as a Sanjio 4, that is the Yang Qi point. So 3 points together. One is the source point, the other one is the Luo point, the third point to be known is the central point. For 3 points together to treat for all the cardiac related disorders, certainly they can save the life and also they can save the money as well. Ren 17, yes, known as a darling को याद रखना, ठीक है. Do you know everybody have darling? Is it so? Okay. You too have darling, right? Or you just remove it off, or you just take off darling. The pronunciation to be known as a T-A-L-I-N-G, that is known as a Ta-ling. Pronunciation is Ta-ling, but writing is darling, right? But keeping in your mind is darling, right? Right. So खुश हो जाते हैं ना darling का तो. Right. Where this point is exactly located? Let me see. Darling in the middle of the wrist crease between the tendons of the palmaris longus and flexor carpi radialis.
P6 location.
Oh, location I didn't say, I just applied. To chon proximal. Proximal means is above. Then midway between the two tendons again, it is the flexor carpi and then palmaris longus tendons. Now let me see where is the pericardium 7 point is located. Already I told you there is the midway between the two tendons, but in the same way how to locate that point, you come to the pericardium 6. First you have to stretch your hand. First you stretch your hand, then you find out the two tendons. In this tendon, from the tendon, you just come forward. Where there is the wrist, it comes, that point to be known as a P7. You touch and feel. Yes, you stretch. You touch and feel. There are the two tendons here. You come forward, you come forward, you come forward. Then where you can find the wrist crease, that to be known as a pericardium 7. Where there are the two bones are there. One bone to be known as a triquetral bone. The second bone to be known as a lunate bone. How many carpal bones are there? Totally 8 bones are there. In that 8 bones, but midway between the two bones, midway between the two, this longest bones, this called as the radius and ulna. This is the radius and ulna. But here there are the 8 bones are there. In that 8 bones, there are the 2 bones are here. One bone to be known as a, this bone to be known as a lunate bone and the triquetral bone. Lunate bone and then triquetral bone. Midway between these two, in the depression, this point to be known as a pericardium 7. Pericardium 7. I inserted here nearly 0.75 chun, inserted this needle towards the pathway. Now this is the pericardium 7, I just activated, but however you wanted to use this point as a tonification or this point to be as a sedation to be taken place in the same point, I just treated as a tonification. I just treated for the got vibration. One is the tonification, other one is a sedation, right? Because in the two conditions, sometimes we use as a tonification, sometimes we use as a sedation as well. But what conditions we need to sedate, what condition we need to tonify. If you are in dilemma, when you are in dilemma, you wanted to use as a perpendicular itself is the same point. You just insert the needle. So on the perpendicular region, so this is called as a one acupuncture point, but you are using the 3 needles. But now we don't know whether the energy is required or energy may not be required, or energy is deficiency or the excess, we are not very sure, to get that neutralization. 1 point tonification towards the energy flow, and 1 point opposite direction of the energy flow, 1 point is the perpendicular. This is in fact is the my innovative method of this as a needling, but however this can be used to being at this point is sun point. The pericardium 7 is the darling is sun point. Always darling is sun only, right? It's not that supreme level. They sit on the top, then we will become sun. So that's the reason let they keep it as a sun. So this darling is the sun point of the pericardium meridian. The darling, that means the opposite direction we just apply the needle, that would be good as a sedation to be taken place for the pericardium, right? And being a sun point, it sedates the energy, and this point to be known as a earth point. The pericardium 5 point is metal point. Pericardium 5 is the metal point, that to be known as a adrenal gland point. The pericardium 5 is treatable for the adrenal gland. All the adrenal gland related disorders can be treatable by activating the pericardium 5. Then the pericardium 7 is treatable for the one endocrine gland, that to be known as a pancreas gland. One to be known as a pancreas gland. That's the reason pericardium 7 is the great point to treat for the which disease or which disorder? Diabetes mellitus successfully treatable by activating to the darling point, right? If darling is good, that means is the either it is your darling or the pericardium 7 darling, or the wife is darling, wife also darling. If that darling is good at home, then husband also good. When the BP or the sugar get increases because the darling is dysfunction, darling is not cooperating, yes or no? If they will have the problem, then the FM means FM or the HM, that means is the finance minister also she only, and HM home minister also she only, right? And Bharya also she only. So therefore having any problem, then the husband blood sugar it get increases. When the peace of mind is there to the husband, that means is the wife also should be reason to increase the blood pressure or the hypertension or the diabetes mellitus. You will come to know once you will get the marriage. Now he is laughing. So sir is telling something is blah blah. He is thinking that, so because somebody told me, sir, you increase my energy, at least I get 4 wives, he said. He didn't get married yet. He is my student. But he came to treatment, but he is telling me, increase my stamina, I have the desire to get 4 marriage. Then I said, first you do 1 marriage, then we'll think about whether need to do another 3 marriages or you need to withdraw this. You will going to tell after the marriage, I said. So yet to get marriage, here also one angel is there, male angel. So he also come to know when we are going to get the marriage. So that time. So this darling is very important. I mean to say pericardium 7 is directly having the impact because each and every meridian, that means is the pericardium meridian is governing to all the endocrine glands in our body. Pericardium meridian is the endocrine gland meridian. No doubt the triple warmer is the endocrine meridian, but that is the acute problems can be treatable by the triple warmer meridian, but the chronic diseases of the endocrine system can be treatable by the pericardium meridian. So therefore P7 point is the great point to treat. Right side or the left side, vice versa, you can use it, or the bilaterally you wanted to use it for the diabetes control point to be known as a pericardium 7. Tonification or the sedation you can do it, but the sedation is always is good. Pericardium 7, sedation you can do it, because you know there is a formula to be known as a to control the diabetes mellitus. We used to have the lecture, or we used to have debate that there are the 4 points, you keep it in the mind. 1 point to be known as a LU7, the second point to be known as a pericardium 7, the third point to be known as a spleen 6, the fourth point to be known as a liver 1. These are the normal protocol which will be really useful for the 4 needle technique, can be used to treat for the diabetes mellitus as well. So therefore you can use, there are the 4 points which Dr. Bhojraj sir is, we were discussing that these points are really good point to treat for that particular disorders. So therefore you just add up 4 points for the diabetes. Along with that you wanted to use this point to be known as a Darling point, when the distal point for the another one condition that to be known as a calcaneal spur pain, or the retrocalcaneal issues, or that to be known as a heel pain, especially plantar fasciitis, inflammation of the plantar fascia having the problem. So that time you can use the opposite side. For instance, the pain is on the right side of the heel pain, then you can use the left side is advisable. Left side is advisable, vice versa. So therefore the pericardium 7 is a great point to treat, also to be CTS problem, carpal tunnel syndrome related disorders. When this specific region, do you know the entire region to be known as there is a band is there, that band to be known as a retinaculum. The ankle also there is a band, wrist also we having the band, to control, to regulate and to cover, to wrap, to enclose all the carpal bones. How many carpal bones? Very smaller bones, carpal bones are there. In that smaller bones, that shouldn't escape. So to tightening the band, how we do the scrub bandage, likewise there is a band is there, so that band to be known as a retinaculum. So that area, so there is that band, what happen, it get compression to the nerve called as a median nerve. When the median nerve that get compression, that causing the problem like a carpal tunnel, this area to be known as a carpal tunnel area, where that retinaculum covers area to be known as a carpal tunnel. Now the carpal tunnel syndrome is indicating some kind of the collective symptoms. The patient feel the pain on this region, where on the medial nerve on the forearm getting the pain and also numbness. Further patient feels some kind of the problem on the thumb, and then index finger is the first finger, and then second finger. Sometimes is the half of the ring finger, the 3.5 fingers, the patient feels some kind of the numbness, tingling sensation and pain, that indicating the CTS problem, and always having the convex and concave. This the convex conditions, the patient feel okay. Convex, they have the problem, yes, I have some kind of the pain and also numbness, especially once they wake up in the morning, or sometimes in the sleep they wake up because of the pain. That all are related to the known as a CTS problem. So therefore in that condition we can use this specific point, that area to be known as a pericardium 7 area where the medial nerve get compression. Once we use the needle, so that region that gets some kind of the impulse, and also mild to moderate, you just apply the needle. Half tune is advisable to this region. Then you don't puncture, don't pierce to the deeper level, that should get damage to that nerve, that causes further complication. That's the reason gently and politely you just apply the needle on that region. That always is good. But I applied all the direction, oblique direction, 45-degree I applied, then 90-degree I applied the needles, but it is totally safe. But 90-degree, it has been gone, nearly 0.3 tune needle is inserted on that region, that will not damage to the median nerve. If you puncture to the 1 tune needle deeper level, then it touches. It touches, then withdraw the needle immediately. Don't remain the same. Don't retention the needle for 30 minutes is not advisable, since you inserted the needle to the medial nerve, which going to get the damage. So therefore you just apply for a few minutes. That's really quite enough. That will not cause much harm. So hopefully you understand about the darling, right? So you will get 1 darling or 2 darlings do you require? Not required. That's good. So now not required. So hidden way he required, right? Let me see the another most important points. I think some of the points are coming in this region. Now the carpal tunnel syndrome, it goes like this. The nerves, it goes like this. From here, the nerves, it goes like this to the fingers. Then this region also you should activate to the carpal tunnel syndrome, like a local points you just activate. You can use as a local points you just activate. For example, now I just apply the needles to this direction, then this direction, then this direction you just apply. That means I applied to the these needles are called as a lumbrical needles. Lumbrical muscles, also called as the lumbrical nerves or the lumbrical muscles. Lumbrical means don't think about the lumbar. Lumbar means is the back. But lumbar muscles are different. Lumbrical muscles are different. Lumbrical. Lumbrical. Yes, lumbricals. How many lumbricals are there? 4 lumbricals are there. So what are those 4 lumbricals? This is the first lumbrical. This is the second lumbrical. This is the third lumbrical. This is the fourth lumbrical. So therefore these muscles having the problem because of this, the medial nerve, radial nerve, ulnar nerve, palmar nerve, digital nerve, that nerves are not passing properly to the fingers, that leads to the problems. Therefore you just apply the needle to circulate the blood flow to that region, certainly having the great impact. Now, so pericardium 8, please change karko diyo Safni. The pericardium 8, now I'll give you some of the most important information, but each and every point is important. Howda ilvama? Hyderabad biryani na, Bangalore biryani na, Madurai biryani na, Singapore biryani, yen biryani tintira ನೀವು? Ella biryani tinta iddira, howda ilva? Yes or no? You are eating biryanis, yes or no? Which is a delicious food is? Biryani na? Or you say desserts also, right? Sometimes you are eating. I don't nourish you anything, but you are eating. क्या सर क्या बीज देते नहीं फिर बोलते बिरयानी खाते मिठाइयाँ खाते हैं. Now let me see the next point to be.
Slide, please.
Pericardium 8. So numerous ways you can identify the point, but still as a super simple way you wanted to identify, close your fist and then yes, touch your middle finger, then that point is normally considered as a pericardium 8, that is a love Kung point. Yes, you just do it. But where is precisely this point is located? Midway between there is a second and then third finger touches to the palm. Midway between that point to be known as a Lakung. It's not that it touches. This the point is not the pericardium 8, but you flex it, all the fingers. Then midway between the second and then third finger, where it touches, that point to be known as a pericardium 8. You just touch and then, yes, correct. You just leave it. Just I used the one needle, that to be known as a pericardium 8, which is the really good point to treat for the numerous diseases. But however, the P8 point, I inserted the needle where FDA approved needles. This is called as a micro needle, which one chew needle we applied on the specific region as a tonification to be taken place. This point to be done as a tonification. Now the point to be known as a in-house point, horary point, self-governing point, without bothering to anyone. This point works under my own work. That means the pericardium work to be taken place without disturbing to this point. The pericardium 7 earth point. That means P7 is equivalent to the spleen 2. Right? Spleen 2 is the mother point. Pericardium 7 is the sun point. Therefore, the earth point of the pericardium is the P7 point. Therefore, all the digestive metabolism, as I told you, the pancreas point. So, therefore, that activating to the spleen, that's activating to the pancreas. By the way, the nerves which passing to the pancreas, that also will be indirectly supporting through the pericardium 7. Now, the pericardium 8, you keep it in the mind. This is the really important to treat for the thyroid related disorders. The pericardium 8 for the thyroid conditions, whether hypothyroid or the hyperthyroid, better you can use the point is pericardium 8. Along with that, you wanted to add up the points to be known as the H8. That means is the Shao Fu. H8 and then the pericardium 8, both the points are really good point to treat for the thyroid related disorders, thyrotoxicosis or the hypothyroid, where the TSH level is greater than 6, 7, 8, 9, 10, 11, 20, 30, 40, 50, 70, 100. That condition also can be advisable using the pericardium 8 point and then the H8 point. Further, you wanted to add up the next protocol to be known as a next protocol, even spleen 3. Spleen 3 you just activate and also you reduce to the K10 point. K10 you just reduce and then P8 and H8 and then spleen 3 a tonification to be taken place in order to treat for the thyroid related disorders. By the way, you wanted to use some of the points on the neck region, that is called as a neck futu renying, chishi, chupen, chihu. What are the points are located here? Stomach 9, 10, 11. Chupen 12. So these are the points are really good point to treat bilaterally. Otherwise, you can use the dry cupping to that region, also really good. By the way, C1, C2, C3, C4. C2, C3, C4, these are the nerves are controlling to the throat as well. So integratedly you can add up the points, that will be really helpful. By the way, being this point is the tonification point, when the pericardium energy is very weak, so where the pericardium pulse is invisible or the impalpable, so that time you just activate this point towards the energy flow the patient feel lot of changes and it increase the pericardium energy as well. So once it increases, then the pericardium energy is good. Headache related problem, polyuria related issues, fatigueness, lethargy, memory, amnesia, intellectuality, cognitive functions, learning related disorders, speech related conditions, mental related conditions, all the conditions you can use this point. By the way, this point having the problem related to the palms having the perspiration, I think somebody told is the hyperhidrosis. That means is the excessive secretion of this excessive secretion of the water in the hands. That's called as a sweat glands or secretion is more. So that time you can use this point to control the excessive secretion of the perspiration, especially for the school children, college boys or girls will get that problem. Certainly you can use this point. Along with that you use the H6 and then the K7 point along with that will having the great impact to treat for the many conditions. Right. So that we known as a, there are the two locations. One is the modern location is different, TCM location is different. Two locations also I'll tell you, but one is the bonus. 2 points also having the bonus. One acupuncture point is connecting to the 4 acupuncture points. How amazing! Kitna beautiful hai. Only one acupuncture point, it covers the 4 acupuncture points. Let me see where that point is located. The pericardium 9 having the 2 locations equivalent to the, but it is the 1 point, it is equivalent to the 4 points. Sir, kaisa ho sakta hai? Let me see. So one by one, the location, let me see. Point 1 chun proximal to the radial corner of the nail base of the middle finger to be known as a chung chung, number 1. The second location to be known as a, at the tip of the middle finger, that to be known as a pericardium 9 point. So which muscle is it? The flexor pollicis digitorum longus muscles. So these muscles having the point location that the tip of the middle finger to be known as a H9 point. Sorry, pericardium 9 point. So P9 or this is the 2 locations also good. Now let me see according to the micro acupuncture, according to the vertical meridian, according to the micro meridian, according to the Professor Park-Jawus meridian, according to the macro meridians what you are studying, the micro meridians what you will going to study about the only 2 fingers having that all the meridians. How many finger? 2 fingers. This is 6 meridian, this is 6 meridian. Collectively 12 meridians in 2 fingers. In that way, if we calculate this, the 1 point which applied 0.1 chun proximal to the radial corner of the nail base of the middle finger, that point to be known as a Li Dui. Li Dui means stomach 45. P9, again it is the stomach 45 point here. But at the same time when you wanted to apply the another point, that is the tip of the middle finger, that point to be known as a Tatun. Tatun means is the liver one. This I think some people having the controversy. No sir, this point is the spleen one, not the liver one. But I don't agree that. But however, the pericardium 9 point at the tip of the middle finger, that point to be known as a Tatun, liver one. That's not the spleen one. But according to the Sujok chart, has mentioned that that is a spleen meridian. First is the liver meridian, second is the spleen meridian. But no, but that should be known as a first the tip of the middle finger to be known as a the liver meridian. So therefore that point to be known as a liver one, at the second point to be known as a stomach 45, the third point to be known as a the pericardium 9 point. So by the way, one acupuncture point is treatable for the numerous diseases if you activate these 2 points bilaterally or the unilaterally, the known and unknown cases of the diseases, you know the reason, etiology and pathogenesis. Sometimes we doesn't know. That time certainly we can use this point in order to treat for the digital nerves or the digital vessels or the digital vein or arteries having the problem where the termination of the finger 1, 22, 23, 24, 25, 26, 27, 28, 29, 30. But her blood is the purified blood. But if she have the darkness of the blood, dark bright red blood, this is the bright red blood, there is the oxygenated blood. If the very dark blood is bright brownish color blood is there, that indicating that is a toxinated blood. So that time you can withdraw amount of the 50 drops of the blood also you can withdraw. In that way, whatever there is a brain toxicity is there, or inside the brain having the excessive unwanted stuff is accumulated, that you can drain out. By the way, this pericardium 9 is equivalent to the Xingqian because this point belongs to the wood point. Wood is regulating to the liver. So liver 2 is equivalent to the pericardium 9. By the way, when the patient having the complaining about the problem is liver and then brain related condition, you can treat. At the same time, when the patient having the hemiplegia, paraplegia, when the brain hemorrhage bleeding is happen, hemorrhage of the bleeding in the brain, that is a very emergency condition, should be taken care in the hospital. But however, for emergency conditions, you withdraw the blood of all the fingers, the termination of the fingers, you withdraw the maximum amount of the blood, patient feel lot of changes by using some of the points. Yes, all the termination of the fingers. So hopefully we will wind up now related to the pericardium meridian.